Hello, my good people. How are you doing today? Dominic here, and welcome to my health talk show today as we keep on educating each other, right? So, today we want to talk about something blood group and Rhesus factor. But before we talk about that, do you know your blood group? Have you ever tested? Or, pora maisha, pora why? You need to know your blood type, right? It's very important. Well, back to the topic. Blood group and Rhesus factor. Many times you've heard of Rhesus positive or Rhesus negative, right? I'm interested to talk about Rhesus negative, especially to female or women, right? What is Rhesus factor? Rhesus factor basically is a protein, a type of protein in the red blood cells in your blood, right? It's a type of protein. So if you have this protein in your red blood cells, we say you are Rhesus positive. But if you don't have this kind of protein in your red blood cells, we say you are Rhesus negative, right? So we do have 4 types of blood groups. Yes, I believe you know about that. We have the O, we have the AB, we have A, and we have B. Those are the 4 main blood types. So for these main 4 blood types, you can have now the Rhesus factor in it, or you don't have it. So if you have Rhesus factor, we say you are maybe, for example, blood O positive. If you don't have the Rhesus factor, we say you are O negative and the likes, right? Leave that one aside. The Rhesus negative in women. What happens if you are Rhesus negative? And why is it important to know your Rhesus factor? In pregnancy, there is what we call Rhesus incompatibility. Rhesus incompatibility happens when you as a woman, you have a blood type that is Rhesus negative, and the father of your child you are carrying is Rhesus positive. So there is that, literally the mixture of the Rhesus negative and the Rhesus positive, which can cause different complications in pregnancy and even after birth, right? So if you happen to know that you are Rhesus negative, you need to know exactly what needs to be done. Make sure in your pregnancy, especially at the 28 weeks and during birth, you get that anti-D injection. The first pregnancy is never affected. In most cases, it's because the body has not been sensitized to produce what we call antibodies against these antigen, right? So for that case, the first pregnancy is never affected. But if you happen that you had a miscarriage or you had a portion for that case on your first pregnancy, then the body has already been sensitized against these protein. So for that case, your next pregnancy can be affected. So it's always good that on your second pregnancy and the consecutive ones, you get the injection. But another thing you need to know, if the father of your child is Rhesus negative, then there is no problem. You don't need to get even anything. If you are Rhesus negative as a woman and your man, who is the father of your child for that case, is Rhesus negative, then you don't need to, because definitely you will have a child who's Rhesus negative. So those are some of the things that you need to know about this thing. Some of the complications that you can get if you have a child who's Rhesus positive and you're Rhesus negative, sometimes you can get a miscarriage, right? You can bleed so much during labor. You can have a child who has what we call hemolytic disease of the newborn, right? So there are many more complications that can come about when you have this kind of Rhesus negative. So there is a lot we can learn about the Rhesus factor in blood type, but I may not be able to mention all about it. But if you have any question specifically for this or another question in regard to your blood type and the Rhesus factor, you can always ask on the comment section or reach me in my inbox if it's a question that you feel it is a private one, right? Health is wealth, as I always say. Keep yourself healthy and keep yourself safe, right? Keep on following my page for more health education as we keep on educating each other. Okay, bye.